So Rachel, I don't know if you remember when you first interviewed to stay on here after your internship. And one of the things that you had mentioned to me was your desire to at some point start a not-for-profit or a charity. And you had explained really clearly and with some passion about why that was so important to you.
I think it really came down to something that was really important was helping people and removing the barrier of money for them and myself. Therapy is really expensive, and a lot of good can come from it, a lot of skills, a lot of learning, and there's just too many people who fall through the cracks, who can't get the help they need.
Well, and I think at that point you had kind of identified too, which I thought was really interesting, how there seems to be programming for those that have no money, and then there seems to be options for those who either have benefit or have money, but it's that middle group where either their benefits really suck or they just don't have the means to be able to engage in therapy long term. Because let's face it, the people that typically really need the intensive therapeutic work are the ones that are on that lower socioeconomic status, because they tend to have faced additional challenges, right? But they're the ones that are kind of caught in the middle.
Yeah, it's almost like they're not so bad off that they can't, function, and they're able to kind of just function in their day-to-day life. And that like little bit of extra help would really make a world of difference, but there's nothing there, right? Like there's programming for people who are really, really low socioeconomic status, and then the people who have, good benefits that can get coverage are getting the help. So it's like this huge range of people who like they either just don't have enough benefits or they can't afford it.
Yeah, and I think that gap is widening too, is something that we've noticed. People who through no fault of their own have like what, $500 a year in benefit coverage, and they want to improve their lives. It's not like they're really, really suffering in a way that would require hospitalization. They can't get that leg up.
Yeah,
and that seems to be happening more and more.
They just need someone to give them a break. They just need someone to, be a life raft for a little while, to help them kind of get over the place that they're at in their life and help them kind of move forward to that next little bit of their journey.
But what made that so important to you? Because I remember it felt personal. Like it really did feel personal.
Growing up as a kid, I was always going to save the world. I always wanted to help people. And that was
kind of your dad's fault too.
Yeah, definitely partly my dad's fault for making me volunteer as a child. And then, coming into university and stuff, I was part of that group all the time that like I didn't really qualify for any help. And then, like we did have benefits, but just not really much and not enough. So getting help and everything was always a fight. It was always a struggle, and it was always figure it out on your own because there was no options for help. And so that was why I was like, these people and this huge range in the middle need help too.
And it's almost like, let's make it easier, right? Because you said, we have to figure it out on our own. Well, what if we just made it easier for people to figure it out? Like we've always said here at Dóchas that if you call in, you're one of ours, whether you end up being one of our clients or not. But now being able to offer them access through the Dóchas Resilience Foundation and those Hub for Hope and all of that, it makes things a little bit easier for people to find great care, right?
Because it's also, like we're branching off from Dóchas for this. I get to keep all the Dóchas values. I get to build off of, what Dóchas has and what Dóchas is, which is, that place that's warm. It is accepting. It is not cold and clinical. And that's not the help that I want to get or give. So the DRF gets to benefit from that and offer the services with treating everybody like they're equal.
What is your kind of vision for the Resilience Foundation, right? I know you have so many plans and they're all amazing. But besides that, there are some key things you've been talking about eventually adding.
Yeah, so like looking at, like, because we have the Hub for Hope program. And the Hub for Hope is very, like, it's meant for, moderate to low mental health distress. It's really about more skills building, short-term therapy. You can do 8 sessions with the interns. It is very short term. And so what I would really like to do next is working on trying to figure out how to get a long-term mental health counseling program for people who can't afford it. And I think that would be a very unique program. So that's kind of the next big project to try and figure out, I think.
If somebody were to donate money to this, which can be found on our website, right? What would that money be going to?
Big important part with the DRF for me is that donations actually go to the cause. Donations are going to go towards the programming. It's going to go towards programming, the Hub for Hope, hopefully one day the long-term program. So it goes to covering cost of supervising interns, cost of materials, anything above and beyond, because right now everything's shouldered by Dóchas, which is great. But as we expand to have more programming and more options, it's going to need more support.
Yeah. Do you want to maybe share what some of your visions are about the type of programming that we could offer?
So yeah, Dóchas Resilience Foundation. Resiliency and building resiliency is going to be a huge part of what goes into a lot of the programming. So it's like looking at groups, whether they're like psychoeducational or skills building, that help to increase resiliency for individuals, help them become stronger and able to cope with more of the life situations, you know, helping everyone on an individual level, but also helping the community as our community members get stronger. So, you know, even helping one person makes a difference. It has those ripple effects. So if we can teach one person, you know, some of the skills they need, hopefully they pass them along to friends, or they can help others, and then we get this like amazing ripple effect where the entire community works together to support each other, and they're strong enough to.
Well, and we've always had that community focus. You've always had that community focus for sure. If someone wanted to access the DRF program, how would they do that?
Yes. So if they want to access the DRF program, they can go to the website. And on the website, there is a page that says the Dóchas Resilience Foundation. You can find out more information about the foundation, more information about the Hub for Hope, donation buttons there if you want to donate as well. And if you hit the Hub for Hope button, if you're signing up for the services, there's a contact form. So we just ask, you know, for name, email, preferred method of contact, and then one of our team members will reach out and set up your profile and get you hopefully set up with an intern for counseling as soon as possible.
What if somebody wanted to volunteer with the DRF? Is that a possibility right now, or is that something for in the future?
Yeah, so right now it's not. It is something in the future, you know, as we start hosting events or fundraising, then hopefully we'll have the opportunity for more volunteer, or any mental health practitioners who are wanting to maybe volunteer hours to our long-term programming. That's going to be an option as well. For everyone else, how you can help is sharing our post, engaging with us on Dóchas' social media.
When you talk about the people that the DRF can help, you did specify that right now with Hub for Hope, it's for people with maybe not complex trauma needs. What does that mean? And how does that work? Where do people have to live to access it? All that. Like, who can access it and for what issues?
Okay, so currently, yeah, the Hub for Hope is looking at kind of the moderate to low mental health distress. This might look like challenges with anxiety, depression, relationships, ADHD. You know, there's quite a large list. Grief,
loss.
Of potential things. You know, thankfully at Dóchas we have a really large team of practitioners who support the interns, and so it gives them, you know, lots of people to consult with. So we do kind of throw them anything we can.
Yeah.
While they're under our supervision. More of those moderate level problems, and then it could be individual therapy. It could be couples therapy. It could be families therapy.
Group work.
Group therapy stuff.
And 10 and up, right? Ages
Yes.
10 and up.
Yeah, 10 and up.
Yeah. And then in terms of location, we offer telehealth still through.
Yep, yeah,
Hub
we
for Hope,
still have
right?
telehealth, so really anyone in Alberta can sign up.
My idea of it is that we are always going to be in the sharing space. So the DRF and Dóchas will always somehow share space and connectivity. So for those of you who like to see the dogs on site or the service animals on site, you would still have the ability to see that. We believe in offering, I know Rachael strongly believes in this, offering the same level of elite care regardless of circumstance. So just because it is a not-for-profit or a charity, it doesn't mean that you aren't going to receive an elite level of care. That's the whole point behind it, right?
Yeah.
Is that fair
Yeah,
to say?
exactly. And it's just like Dóchas, like, if we can't help you, we're gonna figure out where do we need to get you to get help.
Resourced, yeah.
How do we get you support if we can't, help you with individual counseling at this time, or what do we do to make sure that you're not falling through the cracks?
Yeah. Okay, so what else do you think people need to know, or what is something that's really important for you that people understand about the whole drive behind this, and what makes it so important to support this initiative?
We need community. We need to help people in our community, and helping people heal so they can be happy and healthy and they can support others. And I think a really big part is just, it's about helping those people who think that there's nothing out there to help them, right? Like there's, they've tried to find supports, and there's nothing because they don't qualify, or they make too much money, or they actually have insurance that only covers 2 sessions with a registered psychologist. It's about that huge chunk of people who just fall through the cracks all the time.
It's about hope.
Yeah, and it's about hope and resiliency and building that up.